Live.
Excellent. Thank you. Bienvenidos y bienvenidas. Welcome to the East Los Angeles Service Center for this special community forum of the Civilian Oversight Commission in partnership with the Civil Brand Commission and other community stakeholders, including Los Angeles Sheriff's Department and many other representatives on in-custody deaths in Los Angeles County. Thank you all for being here today. We're joined both by folks in person and by folks online. This forum will start with our customary land acknowledgement. The County of Los Angeles recognizes that we occupy land originally and still inhabited and cared for by the Tongva, Tataviam, Serrano, Kij, and Chumash peoples. We honor and pay respect to their elders and descendants, past, present, and emerging, as they continue their stewardship of these lands and waters. We acknowledge that settler colonization resulted in land seizure, disease, subjugation, slavery, relocation, broken promises, genocide, and multi-generational trauma. This acknowledgement demonstrates our responsibility and commitment to truth, healing, and reconciliation, and to elevating the stories, culture, and community of the original inhabitants of Los Angeles County. We are grateful to have the opportunity to live and work on these ancestral lands. We are dedicated to growing and sustaining relationships with Native peoples and local tribal governments, including, in no particular order, the Fernandino Tataviam Band of Mission Indians, the Gabrielino Tongva, Indians of California Tribal Council, the Gabrielino Tongva San Gabriel Band of Mission Indians, the Gabrielino Band of Mission Indians, Kij Nation, the Huhaviatum of San Manuel Nation, San Fernando Band of Mission Indians, Coastal Band of Chumash Nation, Gabrielino Tongva Nation, Gabrielino Tongva Tribe. To learn more about the First Peoples of Los Angeles County, please visit the Los Angeles City County Native American Indian Commission website at lanaic.lacounty.gov. I'm COC Chair Hans Johnson, and today's forum has been organized by the Commission's Jail Conditions and Staffing Ad Hoc Committee and will be moderated by Co-Vice Chair of the COC, Luis S. Garcia, who is also one of the Commission, who will also be joined by the other members of that ad hoc committee, including Ms. Irma Cooper, who has made a significant contribution to today's forum. And I'm also joined by the Executive Director of the COC, Charmaine Mosley, and by the Deputy Executive Director of the COC, and that is Dr. Vakila Ochoa. I want to take a moment and extend my sincere thanks to all of the subject matter experts gathered here today who have agreed to join us. We are grateful for your willingness to participate in this important forum and to share your knowledge and expertise and to shed light for Angelenos about these important topics that we've been digging into for many years, and in this case, for several months, about in-custody deaths. Your contributions are an important part of the conversation. The lineup of experts on the panel includes Captain Monica Boteo of the LASD, Dr. Tim Belovich and Dr. Sean Henderson from Correctional Health Services. Welcome. Dr. Ode Ukpo from the Medical Examiner's Office, Dr. Jonah Walters from the UCLA Institute for Society and Genetics. Did I misstate that?
No, that's correct.
Okay. Catherine Wright from the OIG's office, and Chair Haley Broder from the Civil Brand Commission of Los Angeles County. Allison Ganter from the BSCC, and Dr. D. Plain Lucas from Policy Pathways, and Helen Jones from Dignity and Power Now. Thank you to each and every one of you for coming here today and to sharing your insights and discussing this important topic. I will now turn it over to Co-Vice Chair Luis Garcia. Thank you, Luis.
Thank you, Chair Johnson. The purpose of today's forum is to provide greater transparency and public understanding about what happens after an in-custody death. This issue remains urgent and deeply concerning. According to the Los Angeles County Sheriff's Department published in-custody death data, there were 46 in-custody deaths in Los Angeles County jail facilities in 2025, and 13 deaths that have already been reported in 2026 as of April 9th of this year. These are not just statistics. They are human lives. They represent families, loved ones, and communities carrying real loss. The frequency of these deaths underscores why this conversation matters. Our responsibility is not only to ask what happened after a death, but also to examine what systems, practices, safeguards, and failures may have contributed before the death occurred. This is why transparency, oversight, and accountability matter. The Civilian Oversight Commission exists under Chapter 3.79 of the Los Angeles County Code to improve public transparency and accountability with respect to the Sheriff's Department through community engagement, oversight, analysis, and advice to the Board of Supervisors, the department, and the public. Today's conversation is important because in-custody deaths sit at the intersection of custody, healthcare, and oversight. At the county level, this includes the Sheriff's Department, Correctional Health Services, the Medical Examiner, the Office of Inspector General, the Civil Branch Commission, and this commission. At the state level, local detention facilities are also subject to BSCC Title 15 minimum standards, which establish baseline requirements for health, safety, and conditions in our county jail. Again, we truly appreciate our panelists and everyone in attendance. Thank you for being part of this important conversation and for helping advance a more transparent, accountable, and prevention-focused public dialogue. Before I turn it over to Commission staff, Robert Flores will go over the code of conduct and explain the public comment rules. I would like to briefly explain how the public can participate in this forum. I don't have the rules, so that would be you.
Before we proceed, I'd like to reiterate that we are providing real-time AI interpretation of this meeting that supports more than 50 languages. Here's how you can access Wordly. On our meeting agenda, you'll see a QR code and a URL scan and a URL. Scan the QR code and click the URL, then click on Attend. Once you have chosen your preferred language, translated captions will appear automatically on your device. Virtual meeting attendees can listen to the translation in real time by unmuting the speaker icon. Attendees here in person will need to use their earbuds or headphones. To ensure a productive meeting for all, please follow the code of conduct as follows. Speakers must cease speaking when their allotted time has ended. Public comment must be related to tonight's forum session topics. Be respectful of the views expressed by the panelists, staff, commission members, and community members. Please refrain from profane, personal, threatening, derogatory, demeaning, or abusive statements. Do not disrupt the orderly conduct of the meeting. A person engaging in conduct that disrupts the meeting is subject to being muted or removed from the meeting. Now I'll go over the guidelines for making public comment. Those wishing to speak in person, please turn in your public comment card here. Those attending this meeting remotely, please use the raise hand feature on WebEx. If you're on the phone, please press *3. Each person called up to provide public comment will have up to 1 minute to speak on an agenda item. The chair has discretion to limit the number of public comments due to time constraints. We will have a Q&A session at the end of panel discussions. Please note that the questions should not focus on specific cases or incidents. We request that all questions be asked respectfully, consistent with the same expectations that apply to public comments. Now I will announce the rules in Spanish. Buenas tardes, le damos la bienvenida a esta reunión a miembros de la comunidad que hablan español. No tenemos un intérprete, pero sus comentarios serán traducidos al inglés para la comisión después de la reunión. Si quieres un intérprete en el futuro, puedes enviar una solicitud 48 horas antes de nuestras reuniones. Si desea hablar en persona, complete una tarjeta en la mesa que dice comentarios públicos. Si desea hablar por WebEx, levante la mano. Si desea hablar por teléfono, presione asterisco 3. Simplemente diga la palabra español antes de comenzar y le diremos cómo proceder. Le daremos 2 minutos para sus comentarios públicos. Gracias.
Following the panel discussions, there will be an opportunity for questions from the community. Community members who would like to ask a question are requested to use the index cards provided and to write questions clearly, indicating the panelist or panelists to which the question is addressed. Once completed, please hand the index card over to a COC staff member at the table who will collect and provide them to myself. Now I will turn it back to Chair Luis Garcia, chairing today's proceedings.
Thank you, Hans. We will now move into our panel discussion, beginning with an overview of the Sheriff's Department's role in the in-custody death review process. We have with us Captain Monica Botello from Custody's Compliance and Sustainability Bureau with the LASD. Captain Botello, I will now turn it over to you.
Thank you. I appreciate the opportunity to speak with you all today um, and provide the overview that you're requesting. I think as an introduction, I just want to emphasize that any incident involving an individual who dies in custody, we all know is a sad and unfortunate event. The department makes a concerted effort to review all circumstances when it involves an inmate death. We always focus now on looking at particular best practices in death mitigation, and we're always ensuring that we focus on areas of a concern to ensure that they're identified appropriately and handled appropriately. And I would say that accountability is really crucial to ensuring lower rates of incidents. My presentation today will focus on a broad overview of how the department investigates the circumstances of an in-custody death. Next slide, ma'am. So an in-custody death preliminarily is defined as an inmate death that occurs within LA County Sheriff's Department within its jail system. And that would include not only the jail facilities, but the court services division lockups and the patrol stations jails. Okay. When an incarcerated individual passes while in custody, immediately following that passing, there's a series of procedures that department personnel engage in. And primarily, initially, that's going to be one of notification. And I'll talk about some of the other procedures and steps we take. But initially, it's the facility watch commander at those respective facilities that actually start that notification process. And as you'll see behind me on the slide, there are branched out series of notifications that are immediately made. You have the chiefs, the executives that are notified, the unit commander of the respective facility, Homicide Bureau, Internal Affairs Bureau, the Office of Inspector General. You have the watch deputy with the Inmate Reception Center. You have the Sheriff's Information Bureau, the Sheriff's Medical Command Center, the Twin Towers Correctional Facility, the Civil Litigation Risk Management Unit, and myself and my team at Death Review. And just as a preface, the Death Review team is incorporated within the Custody Compliance and Sustainability Bureau. So that is a unit that I directly oversee. So when that happens, after that the event happens and notification are made, my team itself does a series of separate notifications as a response to eventually roll out to that scene. And next slide, please. So we have our own, and that also includes a duplicative but a necessary notification to our respective commanders and executive staff. We also notify the Board of Supervisors, County Council, again, the Office of Inspector General. Immediately following those notifications, my team and whoever's assigned, which is an on-call basis, will start to gather and collect all of the relevant information involving the circumstances of that incarcerated individual's death. Not only does that include the arrestee and booking information, but we're looking at all of the relevant video. We're intending to collect that right away, as well as all associated reports that are going to be generated out of that facility regarding that inmate death. We also then respond, depending on who I have within my team on an on-call basis. I have a deputy and a lieutenant who responds out to that location. And immediately in doing so, they're there to get a thorough debrief when Homicide Bureau responds to that location, which includes their personnel, typically a lieutenant to begin with and 2 sergeants. And we all gather together when they're ready, when they've done their preliminary investigation, and we do a debrief with them. And that includes a walkthrough of the scene following that, that debrief, the walkthrough by homicide, we do a second one with homicide. And we learn preliminary information regarding the circumstances of that inmate death. Next slide, please. Contingent upon that as well, of course, when you have this unfortunate passing, there's next of kin notifications that are made. We have the County of LA medical examiner that makes the next of kin notifications, and Homicide Bureau facilitates that with the DME or the medical examiner's office when they're investigating the in custody death. When you have an incident or a passing that occurs at LAGMC, which is LA General Medical Center, you have their medical staff that also notifies the next of kin and facilitates that. At that point, you also have family assistance program that works with Homicide Bureau to facilitate and ensure those next of kin notifications are made. Next slide, ma'am. In the days following the death review team still works on gathering all of the relevant data. There's many notifications that we obtain and acquire that we're still making in many ways. We also do a search of all of the CCTV video, closed circuit television video, and body worn camera video that's relevant to the circumstances of that inmate's death. They also prepare a preliminary review summary, and that summary is taking a look at everything that happened from the time of that individual's arrest and through his intake and into our facility. And then we also prepare a multimedia presentation that includes that inmate custody's profile. We also include the applicable video footage and a timeline. We also offer a pretty exhaustive timeline of all of the events leading up to that inmate's passing. And then we have a specific focus looking at the time of discovery and then the post-medical response by personnel and by both from sworn and by correctional health services. We also, of course, go ahead and update the public transparency website immediately within our department, and that becomes available, and that's through legislation that we do that, and we are very compliant in that regard. At that point, we also schedule that preliminary death review. So all of the information we have compiled will now be presented during an actual executive inmate death review, which we call the preliminary review. And we invite a series of individuals that attend. Next slide, please. In the preliminary executive death review, as you see here, there are numerous people that attend that review. And many, oftentimes they're in person, and then you have people also coming in through a teleconference means. So you have the executive, you have the chief over the division, you have the facility unit commander, you have the commander as well, you have myself. The death review team presents, so they're there, of course. You have custody training and standards that are present. You have Custody Support Services Bureau. As you see here, there's an entire list of people who are in attendance. And we also have the United States Department of Justice, who also sit in and listen to these preliminary death reviews. And in fact, they listen to all of the subsequent death reviews that occur following that same inmate's death. Because this is only the preliminary, we actually, in many cases, do additional death reviews until all of the areas of concern are adequately and appropriately addressed. Next slide, please. So, as I mentioned, when we hold that preliminary death review, we present that multimedia review of the incident, and we discuss his custodial history. We discussed all of the events leading up to the inmate's death that are relevant, and we always focus on the subsequent emergency response. The division chief begins to identify areas of concern that he or she may have. They'll issue inquiries to the unit commanders or the appropriate entity with respect to the question or the line of inquiry they have, and then they'll request follow-up. That particular chief or executive can request follow-up of that unit or of the entity, particularly maybe CHS in one instance or another, or maybe it could be a facility of infrastructure question. So that appropriate entity will be tasked with answering the follow-up question that executive will have, especially as it relates to a variety of concerns. I mean, it becomes quite broad in how we approach this. And after he or she addresses her areas or his areas of concern, you also have the attendees that are systematically afforded the opportunity to provide input, and they do so. These particular death reviews are done very systematically, very methodically, with an understanding that we're wanting to know areas of concern from all of the stakeholders that are present. Inquiries that are follow-ups for CHS for Correctional Health Services are forwarded included, and CHS or Correctional Health Services includes them in their separate mortality review, which they may speak upon later. Next slide. So during our subsequent death reviews that we may request, we're actually reconvening at some later date to then answer all of these follow-up task items. And these task items are monitored by the death review team to ensure compliance and proper proof of practice. I've listed here, I've listed here the various examples that we give or that we deal with systematically. Some of these lines of inquiry are pretty standard because we're looking at a variety of issues. I would say they cut across 5 different modalities that I can speak on, but dealing really primarily with the Title 15 or the inmate safety checks that are conducted prior to that individual's death, because we're required by law to do so. We want to make sure we're compliant there. We're looking at the time of discovery and how the circumstances leading up to that, and what was our response once that discovery occurs, and what was our emergency medical response thereafter. Once that is all done and the executives and all the stakeholders have addressed their concerns satisfactorily, the death review team then compiles a quite voluminous death book that includes homicides investigation, the psychological autopsy, and the autopsy itself. Any and all relevant documents related to our corrective action or our lines of inquiry are then included in that book. I would say that that concludes my presentation. I look forward to answering any questions that you may have. Thank you.
Thank you, Captain. Our next speaker is Dr. Tim Belovich, who is the Director of Los Angeles County Correctional Health Services, the nation's largest county-run correctional health system. Dr. Belovich, the floor is yours.
Thank you. Good evening, everyone. Again, my name is Tim Belovich. I'm the Director of Correctional Health Services. I'm here tonight also with our Chief Medical Officer, Dr. Sean Henderson. Dr. Henderson actually chairs our mortality review, and so he's going to speak to the specifics of the healthcare role in reviewing mortality. Okay.
So we have a separate medical review that looks at accountability to make sure that we followed all the protocols that are supposed to exist, that the care that was provided from the time they come in the door, individual came in the door till the time of the event are, I'm sorry, yes, perfect. Not close enough. Even closer. Lordy. All right, to make sure that we followed the protocols, we also look at the care that they received from the time they came in the door to the time that the event occurred. And then we look for areas of being able to improve our system or gaps in practice. If you'd go to the next slide, I'd appreciate it. Within 14 days, the individuals, the nurses, the mental health providers, and the physicians responsible for the area that the individual was housed in evaluate the clinical care. They review the entire medical record. They provide a summary. The summary includes not only what occurred, but anything they see that are areas of concern. These don't have to be, in the end, things that are critical, but anything at all that they see that's outside the norm or that should have been addressed. We want to make sure that we followed our own protocols, but we also want to look for missed opportunities. Was there a gap? Did we not listen? Did we not hear? Was something not seen? Next slide. I mentioned just quickly, there's also a piece of psychological autopsy that occurs only for suicides. It is not typically it's always conducted by a qualified mental health professional who is not directly involved in the decedent's care. It reviews the mental health, disciplinary records, again, looking for a history of self-harm, recent medication change, anything we missed appointments, a court sentencing, changes in housing. They look at the cell and the suicide method to see if there was something, again, that contributed to the death. And then they make a final observation and recommendation. We include that and send it to Captain Patello. Every week on Tuesday, we have a meeting about reviewing deaths. Every other week, the OIG, the DOJ, and LASD representatives attend and we go over the cases in detail. We spend an hour going over each individual death. We review what we found, we discuss what we want to change, we identify correction action plans, and we assign them to individuals to complete. We track them until they're complete. And some of them actually become long-term improvement plans because we want to really change something systemically, and it's going to take longer than a month or 2 months. It's going to take 6 months or a budget request. So we create that document, we summarize it, we send it to the captain, who includes it in a subsequent LASD review. I would note, I don't think it was mentioned, I am at every single one of the LASD death reviews as well to look and see if the environment played any role, if we had, what else we can learn from having watched the footage. So that's our death review as it stands at this point. Thank you.
Thank you, Dr. Henderson and Dr. Belovich. Our next speaker is medical examiner Dr. Odesi Ukwo. The Department of Medical Examiner conducts independent death investigations, including those occurring in custody, to determine the cause and manner of death. Dr. Ukwo, please begin.
All right, good evening, everyone. Thank you for having me at this presentation. Dr. Odesi Ukwo, Chief Medical Examiner. Next slide. All deaths that happen in custody fall under the jurisdiction of the medical examiner in LA County. So therefore, all of the cases are investigated by us in comparison to about north of 70,000 deaths happen in the county. We have jurisdiction over approximately 12,000, but all cases that of individuals dying in custody fall under our jurisdiction. Next slide. The personnel that's involved with our death investigation is first the medical examiner investigator. And I want to be clear that investigator in this term is for the medical reasons for the person dying. This is not a criminal investigation. These are individuals that work independently from our office to gather information about the circumstances surrounding death. The deputy medical examiner is the physician who will do the examination and autopsy to determine the cause and manner of death. They are assisted by a forensic technician that assists them to do the autopsies. And another important person in our group would be the criminalists. These are the folks that do the toxicology testing that is done on the specimens, such as blood that's taken from the individual to do toxicology testing. Next slide. This is just an overview of our procedures. I'll just go quickly over them. That first, we fully examine the body and take photographs of the individual in our studio. We have a CT scanner or a CAT scanner, as people are familiar with. LA County was one of the first to incorporate this into medical legal death investigations. And we do them on all our in-custody deaths. Deputy medical examiner then reviews the circumstances surrounding the death. The information comes from the investigator. Sources include law enforcement and sometimes includes information from the family regarding past medical conditions, etc. The investigations that are, the agencies that are investigating the death are invited to attend the autopsy. there's a request made by these agencies, and we advise them of when the autopsy is occurring. Examples of individuals that would come would be correctional health individuals, also the sheriff's department, OIG, DA's office, and the like. This fully encompasses all in custody deaths, so this also includes officer-involved shootings, so that's why I have this list of folks here. We examine the body externally, just like a doctor's office. You look at the body from head to toe and then do a autopsy, which is a surgical procedure to determine the cause and manner of death. Next slide. So after the autopsy, immediately after the autopsy, the body is available for release to the family from the mortuary. We await toxicology results on a good number of our cases and certainly a large number in the in-custody deaths. The results are complete within 90 days, 90% of the time for toxicology, but cases can go beyond that and need additional testing to be done. We complete the autopsy report when the cause of death is determined. However, the final report isn't ready until all the aspects of the report are ready to be released to the public, which would include toxicology results, for example. So it could take 4 to 5 months after the death for it to be available to the public. It is shared with law enforcement or requesting agencies for the autopsy report. Next slide. And I'll just go quickly. The death certificate, I just want to make sure that people understand that we don't issue death certificates. There's a misunderstanding that our department is where death certificates are produced. We just provide the information as to the cause and manner of death. This is actually issued by the state, the death certificate, and we just provide that kind of information. The death certificate can be found with the funeral home where the family had the individual go to, or you can get it from the state. Next slide. I'm not going to go through all the purposes of the death certificate, but I just show that there's many uses for the death certificate. On the upper right-hand corner, you see information as to the cause and manner of death and circumstances of death. That's where the medical examiner is involved. The other information, a lot of it comes actually from the funeral home and other folks. Next slide. Cause of death determination, there's a little bit of confusion of how we end up making a cause of death determination, but think of it as the essential factor that was required for the death to happen. And an example of this is, if, let's say we have a 7-year-old here, moving boxes all afternoon, sort of rigorous activity, and they end up dying at the scene. If they have heart disease, then the cause of death would be heart disease. And I know that someone sees this situation, they would say, no, it was the fact that he was moving boxes, et cetera. That's what the cause of death is. And that's not what's incorporated into the consideration. It's rather looking at the essential factor for this individual. It was their heart disease that set the chain of events that led to death. Next slide. Quality of care is not in the purview of the medical examiner to determine. We don't have the expertise to say that any particular condition would not have resulted in death without a particular action being taken. So there's a misunderstanding that we are sort of this regulatory body for quality of care determination, but we do not have the expertise of the various medical specialties to know which condition would have had a different outcome based off of different action taken. The autopsy is taken as a snapshot in time. It's not to tell the sequence of events that led up to the death, but rather at the time of that the death occurred, we can be able to say that the individual died from X condition, but we do not say that the chain of events that led up to the death, we cannot determine it from the autopsy alone. We cannot, I mentioned that, we cannot determine if an action was taken would have led to prevention of the death. We have to leave that to the experts who treat that particular condition. Next slide. Lastly, I just wanted to talk about identification, notification of next of kin. We are responsible for identifying the individuals, and we do this by simple means like a driver's license, but we also have scientific methods such as fingerprinting, looking at dental x-rays and the like, or DNA if we need to identify an individual. Notification of the death goes to the legal next of kin, and it's not all family members. It's only the legal next of kin is who we reach out to advise of the death. And sometimes this causes confusion because there's a belief that if the person's closeness to the individual determines if they are the legal next of kin, but that's not the law in California to determine who the legal next of kin is, and that's who our conversations are with. And again, not based off of the closeness of the individual, which I understand can cause some frustration. That's the end of my presentation. Look forward to the questions afterwards. Thank you.
Thank you, Dr. Ukpo. It's great to have you here. In Los Angeles County, it's important to note that the Sheriff's Department doesn't control autopsies or the medical examiner. The medical examiner is an independent agency, just like Correctional Health Services. So it's much appreciated that you are here today to take part in this conversation and to be part of the partnership of oversight that our engagement together entails. I also just want to recognize, while we are not joined by our host in some ways, First District Supervisor and Chair of the Board, Hilda Solis, we are joined by the Justice Deputy from the First District Board of Supervisors. And I want to give a warm welcome to Annabelle Martinez, who is here with us representing the First District staff. Thank you, Annabelle. Finally, for those who may have arrived after the commencement of this session, I want to just remind folks that there are index cards available for questions that can be shared with either at the back table or the side table, and then we will get to your questions after the panelists have provided their insights here. With that, I'll turn it back to Chair and Vice Chair of the Commission, Mr. Garcia.
Thank you, Hans. Our final speaker of this panel is Dr. Jonah Walters, a Chancellor's Postdoctoral Fellow at the UCLA Institute for Society and Genetics and a senior researcher in the UCLA Lab for Biocritical Studies. His research on in-custody deaths has been supported by the Fund for Investigative Journalism. Dr. Walters, I'll now turn it over to you.
Thank you very much. I'm very happy to be here speaking with everyone. Again, my name is Jonah Walters. I'm a postdoctoral fellow and a public health researcher at UCLA, where I work with Dr. Terrence Keel in his lab for biocritical studies. Dr. Keel was actually originally meant to speak here today, but unfortunately he was not able to make it. So I'm speaking in his stead. The lab that Dr. Keel directs and that I'm a part of, what we do is we use critical data science methods to try to understand the problem of in-custody death as holistically and in as much detail as possible. And since we're located here in Los Angeles County, we've had a strong interest in doing this in Los Angeles since the beginning, certainly of my involvement with the lab beginning in 2022. We've also worked elsewhere in the country. We've done similar projects in Maryland, addressing deaths in detention centers there. We've addressed in-custody deaths in county jails in New York State and in Pennsylvania. We conduct our research using publicly available information, in particular autopsy reports, which we analyze using a very detailed protocol, many questions that we answer iteratively over and over in teams, confirming one another's work to generate reliable statistics about patterns, and patterns that can only be observed effectively when we read through very large quantities of data or large quantities of autopsy reports produced over multiple years. I want to emphasize that we've developed this protocol alongside colleagues at UCLA and at USC, some of who are in the room, but also alongside community members and directly impacted people in Los Angeles, people whose loved ones have died in the custody of Los Angeles County, in Los Angeles County jails. Some of these people are in the room as well. The lab published a report in the fall of last year about the steep increase of deaths in LA County jails over the past several years, and I'll be talking about that report and its conclusions in just a moment, and also trying to update it a little bit since we're now, of course, well into 2026. But very quickly, I want to address my own participation and, through me, the lab's participation on this panel. Like I said at the outset, I'm very happy to be here participating and speaking, but I think I owe it to the members of the COC and the members of the public to emphasize that historically, myself and my colleagues have not been treated as partners in review or anything else by the agencies that are represented on this panel. We've been treated as adversaries. This has gone back to the earliest days of our research in which began in 2020, continuing through 2021 and 2022. This was a period during which we were very enthusiastically pursuing data about the problem of in-custody deaths in Los Angeles County. I don't need to tell anyone in this room that the crisis of in-custody death in this county has existed for a long time. It did not begin this year, last year, or the year before. We began attempting to research it in 2020 and immediately dealt with a lack of available information. The first major research hurdle that we had to face was that a large quantity of autopsies were not made available to us by the medical examiner's office. Obtaining those missing reports required expending a great deal of time and energy. And when our first major report was published in 2022, the medical examiner's office, under different leadership, prior leadership, attempted to discredit our research and us personally by issuing public statements questioning our sincerity and our qualifications. The Sheriff's Department, to my knowledge, has never, not once, initiated contact with our lab or responded to our many attempts to initiate contact, despite us publishing multiple reports making recommendations relevant to the Sheriff's Department's stated objective of making their jail facilities safer. In my opinion, those are not behaviors of agencies interested in collaborating with a public research university to address an urgent social problem. Like I said, I don't think, historically at least, the agencies represented on this panel have thought of me and my colleagues as partners. They've thought of us as adversaries. And I'll let the COC and the public come to their own opinions about what that behavior might mean. With the rest of my time, which I realize is dwindling at this point, I'm going to discuss the report that we published in September of last year. This report can be easily found online, and I think it's been rather widely distributed locally, so I'll only discuss it very briefly and give some sort of top-line items. We analyzed data about in-custody deaths that took place during jail incarceration in the custody of Los Angeles County in 2023, 2024, and during the first 3 quarters of 2025. This data was all published online by the Sheriff's Department. Our major conclusion was that demographic explanations, such as an aging jail population, were not sufficient to explain the crisis of in-custody death and the rising rates of in-custody death in Los Angeles County. A secondary observation that we made was that nearly all the growth in in-custody death rates had come from deaths that were designated as natural or determined to be natural by the medical examiner's office, and that the average age for natural deaths among the jailed population hovered right around 55 years old, which was significantly lower than the average age of death among the non-jailed population of Los Angeles County. We also found that the data made very clear that the most frequent age range for death across all categories, all manners of death, was 20 to 29, and this remained constant over the entire study period. And indeed, it's still early this year, but seems to be remaining constant this year as well, or at least there's reason to believe that it will. Rather than showing an upward trend consistent with an aging population causing more deaths, the data actually show fluctuation and an overall decrease in the average age of natural death amongst the jail population. Currently, we don't have the necessary data to say whether or not this trend continues in the current year, 2026, since the ME has released cause and manner of death determinations for only 3 of the people to die in Los Angeles County jails this year. As I said, it's still early, but certainly we have no reason to think that this trend will have been reversed in the year 2026. As I said, our major conclusion was that demographic shifts, such as an aging jailed population, cannot explain the crisis of in-custody death in Los Angeles County jails. The explanation for this crisis is internal to the jail system, not external to it. The data suggests that systemic issues within the jail environment are contributing to premature mortality and have been contributing to premature mortality for some time. We recommend that these issues be addressed through policy changes, including mandatory independent investigations of all in-custody deaths, comprehensive reviews by a third party of the medical care available to people incarcerated in LA County jails, and an independent environmental factors assessment capable of making recommendations about what factors internal to the jail environment might be contributing to premature mortality. Thank you.
Thank you, Dr. Walters. And thank you to all our panelists for those informative presentations. This first panel helped lay out the processes that follow an in-custody death and the roles of the agency involved in review, investigation, and response. We will now move into our second panel discussion on responding to in-custody deaths, oversight challenges, and the path forward. Our first speaker for this panel is Assistant Director General Catherine Wright from the Los Angeles County Office of Inspector General. OIG. OIG provides oversight of the Sheriff's Department, including monitoring in-custody deaths. Ms. Wright, I will turn it over to you.
Thank you. Good evening. Is it okay if I hold this? Thank you all for being here this evening. I know it's late in the day and it's been a long day for most of us. We've been at work and then we came here, so I just want to thank you for your time. I also want to start by expressing my sincerest condolences to anyone in the room that is here because they lost a loved one. My name is Catherine Wright. I'm Assistant Inspector General and I'm representing the Los Angeles County Office of Inspector General. It's a great privilege to join this forum today to share the OIG's role and responsibilities in connection with in-custody deaths that occur here in Los Angeles County. The OIG's mission is to promote constitutional policing and transparency through independent monitoring and public reporting. I think it's really important to start by explaining that the OIG does not investigate in-custody deaths. Our role is to provide independent oversight and monitoring of in-custody deaths without interfering with the Sheriff's Department's investigative function. In June of 2025, due to staffing limitations and curtailments, we suspended responding to the scenes of in-custody deaths. But I'm happy to share that we will be resuming this function in a limited capacity on a case-by-case basis in the coming weeks. Our monitoring encompasses many steps, including responding to the scene of an in-custody death. We are briefed by LASD's Homicide Bureau, and we are provided with a walkthrough of the scene, and we have an opportunity to ask questions. We also attend select autopsies to gather preliminary information. We also review any records we have access to through LASD and CHS databases and systems, including fixed camera and body-worn camera footage. We review any custody or healthcare summaries and timelines that are provided to us by LASD and CHS ahead of death review meetings. We also attend all meetings regarding in-custody deaths, including all LASD and CHS administrative death reviews. And our role at these meetings is to monitor and ensure the review and corrective action plans are thorough and address any relevant issues. At these meetings, we do have an opportunity to ask questions. We raise concerns and we make recommendations for potential follow-up and corrective action plans. We also follow up with command staff and CHS leadership on any systems level issues that are identified. Each quarter, we report on in-custody deaths in OIG's quarterly report, which is titled OIG's Reform and Oversight Efforts, Los Angeles Sheriff's Department. And in these quarterly reports, we give a brief summary of each in-custody death and any issues identified. All of our quarterly reports are available on our website. Regarding the corrective action plan process, we do conduct a periodic review of both LASD and CHS's corrective action plan trackers to determine progress on implementation. We also review outcomes of any supervisor inquiries and administrative investigations related to in-custody deaths. We also monitor recurrent CAPs to identify any systems levels issues. How does the OIG track, assess, and follow up on CAPs? We track CAPs in our own database. We also have a quantitative issue tracker. We do conduct system level analysis of our own data for recurrent CAPs. And at the direction of the Board of Supervisors, we will be including more reporting regarding in-custody death caps and status of implementation in our future quarterly reports. Thank you.
Thank you, Catherine. Our next speaker is Haley Broder, Chair of the Los Angeles County Civil Brand Commission for Institutional Inspections. SBC provides independent oversight of county jail facilities through inspections and reporting on conditions of confinement. Ms. Broder, please go ahead.
In just a second, I just want to note that there are copies of an in-custody death chart produced by COC staff for the last 3 years that are circulating, a very helpful reference point for the crisis that was described by Dr. Walter in his remarks. And also just to note that we're joined tonight by the Family Assistance Program, which is run by the Office of Violence Prevention here in Los Angeles County. Welcome, welcome to the FAP staff who are here under the Department of Public Health in Los Angeles County. Thank you for being here for this valuable discussion. Haley?
Thank you so much. Good evening, everyone. Thank you so much for being here. And thank you to the Civilian Oversight Commission for organizing this forum and for inviting the Civil Brand Commission to be part of this conversation tonight. My name is Haley Broder. I am the chair of the Civil Brand Commission for LA County. The SBC conducts unannounced, unescorted inspections of the conditions of confinement across LA County jails. The commissioners go into the jails and talk to people and try to understand what the situation inside looks like and what's actually happening and report that back to the public. All of our inspection reports are public and are online and are available. Our commissioners are not law enforcement. We are community members. We are social workers, lawyers. We are people who are passionate about working on this issue and acknowledging what is happening inside. I want to point out the importance of these independent, unescorted, unexpected inspections, where we're able to go into the jails and actually report on what is happening. One of our former commissioners, Professor Kelly Little Hernandez, says that mass incarceration is mass elimination. She says that incarceration operates as a means of purging, removing, caging, containing, and disappearing and eliminating targeted populations from land, life, and society in the United States. And that's what we're seeing happening. When we go into these jails and conduct our inspections, we see conditions of confinement that are not conducive to safe, healthy lives. We walk into the jails, we see different modules, we look at physical conditions, sanitation, discipline, healthcare access, and we talk to the people who are incarcerated and we hear directly what is happening. In 2025, we noted that 46 people died in the LA County jail facilities, and I want to acknowledge that those are 46 people, human beings, people who are impacted are here today, and I really appreciate you taking the time to be here and to have to listen to this horrific conversation. It's not okay. And we also acknowledge that many people were pre-sentenced, meaning they had not yet been convicted and were awaiting trial, and they died while in custody of LA County. Black and Hispanic individuals are overrepresented among those deaths relative to their share of the general population, which is not an accident and reflects the structural inequalities baked into every layer of our criminal legal system, inequities that compound once someone is inside a jail. We are not part, as the Civil Brand Commission, of the death review process, and we are not part of any aspect of the follow-up. All we can do is go in and inspect what's happening when we hear. We receive an email along with a notification when the transparency website is updated that says somebody has died in X facility. We try to go in and inspect that facility if we are able. We are only allowed 2 inspections per month per commissioner per our mandate. And we will go into those facilities as possible and speak and see and hear and provide the community the perspective that we're able to per our ability. Within that, though, we review and discuss the deaths that we see with the Sheriff's Department and Correctional Health Services at our monthly meetings. And what we have identified is that these are not isolated incidents. There's a pattern, recurring systemic concerns around mental health, care treatment, medical care treatment, supervision, and coordination. And I want to be very clear, as Dr. Walter said, this is not natural deaths. There's nothing natural about death in a facility that is moldy, bug infested, and environmentally degraded. The conditions transform the environment, and chronic stress, overcrowding, poor nutrition, violence, isolation, and environmental conditions accelerate disease, worsen outcomes, and even the deaths attributed to illness are shaped by the conditions of confinement. And this is a public health crisis that we have continued to report on as the Civil Brand Commission for many years and will continue to raise to the Sheriff's Department and to the county. We are highly concerned about the Title 15 safety checks that are not being done properly, which we observe on a regular basis and report back. And we are very concerned about a lack of care in a culture and environment where people and the movement of people are considered bodies. Again, human beings are dying in the jails. We are deeply troubled. And the Civil Brand Commission does what we can through our public meetings, through our inspections, to report on this. We have asked for corrective action plans, and we have flagged that the same conditions inspection after inspection are not improving. That's mold, poor circulation, mental health crises, not receiving proper treatment, improper Title 15 safety checks, overcrowding, rotten food. This does not inspire health. 46 people died in our jails last year, and this status quo is unacceptable. The people we are talking about are members of our community, and it is our job as the Civil Brand Commission and the job of every oversight entity here and for the county to make sure that those deaths do not remain invisible and do not grow in the years to come. Thank you.
Thank you, Chair Broder. Our next speaker is Allison Ganter, Director of the In-Custody Death Review Division at the California Board of State and Community Corrections, BSCC, which oversees standards for local detention facilities and conducts independent reviews of in-custody deaths. Ms. Ganter will join us virtually. Ms. Ganter, please go ahead.
Thank you so much. Good evening, everybody. I'm Allison Ganter. I'm the director of the In-Custody Death Review Division at the Board of State and Community Corrections. This is a new division at the Board of State and Community Corrections. I was appointed by Governor Newsom in October of 2024. I'm really glad to be with you all this evening. I want to say that I'm always humbled by family members who have lost loved ones in jail that attend and speak at these events. And although how you got here is truly dreadful, your bravery and tenacity really do move systems. So I just wanted to say that. I'd like to talk about a few things this evening. The In-Custody Death Review Division, ICDR, our role and responsibilities, including our mission and objectives, the makeup of our division, what we've been doing for the last 18 months and what's next for our new division. So ICDR division was born out of Senate Bill 519 and was established in July of 2024. We are responsible for reviewing the investigations of deaths that occur within a jail and make recommendations to sheriffs related to these incidents, both on an individual and a system-wide, statewide basis. Our mission is to understand why deaths in custody are happening, and with that understanding, work to reduce and prevent deaths in the future. And as a point of clarity, we are not the agency that conducts the investigation. That is the responsibility of the Sheriff's Department. We come in and do the review once the investigation is complete. So we will accomplish our mission by making recommendations, again, directly to the sheriff on policy and procedure changes, training, staffing considerations, physical plant modifications, and the delivery of medical and mental health care. According to our mandate, the sheriff is required to reply to our recommendations in writing and inform us of actions they will and they won't take. With respect to monitoring standards, we have the Title 15 standards of the minimum standards for operating detention facilities in this state. We have an existing set of regulations that one of our other teams inspects for annually. Our division will be developing minimum standards, regulations, terms are interchangeable, and also publishing best practices on preventing deaths in custody as we get into our reviews, as we collect more data and do analysis. And we don't actually have enforcement authority with our standards. We do, however, have the ability to conduct further reviews of death where necessary and with our board support. We also have the ability to request that sheriffs come before our board to discuss issues related to deaths that, such as when they are not following our recommendations or if items of non-compliance continue in the jails. This model is similar to how we conduct our jail inspections. We don't have enforcement authority, but our reports carry weight when there are issues of non-compliance identified. So part of our mandate in ICDR is transparency. We do intend to provide data and reports to the public that are meaningful and user-friendly. And one of the topics for discussion, obviously here tonight, there's different oversight entities and local agencies. We don't have, outside of our review and inspection authority for local detention facilities, we don't have a formal role in coordinating or with or sharing information with other agencies or entities. However, we remain in contact with agencies, and I am committed to communication that will help with our shared mission across all of these agencies and organizations to reduce and prevent deaths. So our division at full capacity will be about 25 people. We have field representatives or inspectors that will be conducting reviews in the local detention facilities. We have an attorney to provide counsel. We have a research division to collect and analyze data, produce reports. We have analysts who manage an incredible amount of information. The amount of information that's coming in is pretty massive. And soon we will have medical and mental health practitioners on board who will do reviews of the delivery of healthcare and mental health care inside the jails. So for the last 18 months or so, we've been collecting data on in-custody deaths. There's been 142 deaths in jails since then. At this time, we are focusing and reviewing only deaths that occur in the local detention facility in the jail and not those that happen in hospitals. We've also expanded our data collection quite a bit to make sure that we're collecting appropriate means and manners of death and other pertinent data that's available out there. We've hired about 1/3 of our staff so far. We only recently received funding for medical and mental health providers, so we're hoping to have our full complement on board this year. We've held multiple listening sessions with community members, including families who have lost loved ones in jail. And through trailer bill language, we've clarified our access to in-custody death records in facilities and have been designated as a healthcare oversight agency so that we have HIPAA access to medical and mental health care records. We've developed procedures for reviewing and reporting on deaths. And within the last few weeks, we have just been receiving in custody death investigations and related documents from counties. And again, I want to say that again, we've just started to receive copies of investigations for us to begin our review. So we're just getting started and digging into those cases. We are beginning our review. We're starting with the deaths that occurred in 2024 and 2025. And we are looking to build our team and get those reviews and publish reports as soon as possible. So in the coming weeks and months, and certainly throughout this year, we're working on publishing data. Our team has built a tool for counties to easily submit data and information for us to publish reports. Again, completing our reviews and publishing those reports, again, in a way that's meaningful and easily accessible, easy to read, and putting our healthcare team together and developing their policy and procedures for review. I'm happy to take any questions that anybody has. Thank you so much.
Thank you, Ms. Cantor. And thank you all for remaining with us through what has been a substantive and at times deeply emotional discussion this evening. We've heard from the representatives of agencies that manage, investigate, and oversee the in-custody death review process here in Los Angeles County. We learned about the systems in place, the protocols, the reviews, and the oversight structures designed to account for lives lost in our county's carceral facilities. But systems, however well-designed, have limits and gaps. Data has gaps. Protocols have blind spots. And oversight, however earnestness earnest does not always provide the level of accountability and transparency, particularly for those families who are searching for answers. This is why it's critical to hear from families directly impacted by these systems. We are honored to be joined by Dr. D. Pulaine Lucas, President Pulani Lucas, President and CEO of Policy Pathways and the founder of Uncounted, the nation's first civilian-led, civilian-reported database dedicated to documenting in-custody deaths. She is also the mother of Stanley Wilson Jr., a Stanford graduate, a former NFL player who died on February 1st, 2023, while in custody of the Los Angeles County Sheriff's Department. Dr. Lucas, we are honored to have you here with us. The floor is yours.
Thank you. Thank you so much. Good evening, everyone. Thank you to the chair and members of the Los Angeles County Sheriff's Civilian Oversight Commission. And thank you to your executive director, Ms. Charmaine Mosley, and her outstanding team for inviting me to be here today to speak with you. But I also, before I start, would like to acknowledge the advocacy exhibited by ACLU attorney Melissa Camacho, Check the Sheriff, Dignity and Power Now, Justice LA, and their leadership and members for pressing this oversight body to include the voices of impacted family members and community leaders. This is essential to have our voices here and to engage in any meaningful conversation about in-custody deaths. And so I want to thank them. It is an honor to be here today and to have this opportunity to share the platform with such distinguished panelists. As stated, I am Dr. D. Pulani Lucas. I hold a PhD in public policy from VCU Wilder School of Government and Public Affairs. And as stated, I am president and CEO of Policy Pathways, a nonprofit organization charged with training youth to become leaders in public policy and public administration. We have several young scholars working with us currently on the project entitled Uncounted. And we are excited to be here, and I know they are online. I want to say hello to all of you who are looking. Normally, we would have our staff meeting tonight, and that meeting was canceled, and they are online. So hello, everyone. But I'm not here today because of my titles or degrees. I'm here today because I'm the mother of Stanley Wilson Jr., who died in the Los Angeles County Sheriff's Department's custody on February 1st, 2023. Stanley was a scholar, a student leader, a track and football star. He grew up in Carson, California. He attended Bishop Montgomery, and he graduated from Stanford University. He went on to play in the NFL. The in-custody death of my son underscores the institutional failures and the real-world gravity of the dynamics between LASD, jails, and mental health hospitals for those who are incarcerated and suffering from mental health challenges. On November 7th, 2022, a Los Angeles County judge found Stanley incompetent to stand trial and ordered a transfer from Twin Towers Correctional Facility to Metropolitan State Hospital no later than December 5th, 2022. Despite the court's deadline, LASD delayed the transfer by nearly 3 months. Stanley was transferred on February 1st, 2023, and died on that day pre-trial in LASD's custody. It is my belief that Stanley would be alive today had he received proper mental health treatment in a timely manner. The intersection between mental illness and mass incarceration remains a critical challenge in Los Angeles County. The rise of mass incarceration has transformed Twin Towers into a de facto psychiatric institution where punitive control replaces therapeutic care and often violates 8th and 14th Amendments civil rights protection for mentally ill incarcerated individuals who are subjected to unreasonable, unsafe, and unjust conditions of confinement. LASD is ill-equipped to provide adequate psychiatric care to inmates suffering from mental illness. When attempting to meet the needs of the mentally ill, LASD faces structural challenges, including environments focused more on punitive measures to control behavior, crowding, limited staffing, and the absence of consistent and primary care style treatment protocols. LASD provides care within a security-first corrections framework with relatively limited therapeutic resources and weaker clinical oversight than mental health hospitals that are organized around clinical treatment and different regulatory and clinical standards that produce very different access to therapy, medication continuity, legal protections, and therapeutic environments. Case in point. On September 8, 2025, California Attorney General Rob Bonta filed a lawsuit against the County of Los Angeles, the Los Angeles County Sheriff's Department, and the County Correctional Healthcare Services over unconstitutional and inhumane conditions at Los Angeles County jails. His complaint states that LASD has engaged in a pattern or practice of unconstitutional policing. They failed to provide adequate medical and mental health care to people inside the jails. He also stated that the lack of access to care contributes to shocking rates of preventable in-custody deaths. According to LASD's own data, over the last 3 years, the number of preventable deaths inside the jails has continued to climb under Sheriff Luna. LASD failed my son, not just as an incarcerated person who had been found incompetent to stand trial, but also as a human being in its care. A court order had explicitly mandated that he be transferred to Metropolitan State Hospital for appropriate mental health treatment. Instead, LASD ignored this directive for 12 weeks. And during the final 6 weeks that they unlawfully held Stanley, LASD subjected him to a dangerous pharmaceutical cocktail of antipsychotic drugs. I believe that this lethal negligence ultimately cost Stanley his life. Based on Attorney General Bonta's lawsuit against LASD and the County Correctional Health Services, Stanley's case is not an isolated incident. Incarcerated individuals with mental health challenges are frequently subjected to excessive medication. When in-custody deaths occur, the cause of death can too easily be categorized as natural, labeled as a heart attack or pulmonary embolism. But closer examination of the means of death would reveal that intense restraint might have caused the heart attack, or excessively high levels of pharmaceutical drugs in the system might have caused the pulmonary embolism. LASD sought to hide Stanley's death. You want to know how? I was provided video footage of the morning of Stanley's death from about 6 a.m. to about 9:05. The last hour of Stanley's life, there's no video footage, no body cam footage, no footage from mounted cameras, no footage from phone cameras. In 2026, surveillance is everywhere. No footage from inside a van. So the last hour of Stanley's life, we don't have video footage. Also, LASD abdicated custodial responsibility of Stanley's body at the time of death. That meant that it did not trigger internal affairs to do an investigation immediately. Not only did LASD not accept custodial responsibility of Stanley's life, but neither did Metropolitan Hospital. So there was no administrative review immediately done that investigated the death scene and pulled video footage or interviewed individuals at the death scene immediately. That did not happen. So all of that information was lost. Was that by accident? I don't know. But here's the other thing. Even today, Stanley's death is not listed on LASD's online in-custody database. He's not listed on their death tracker. Even though recently a judge ruled that Stanley was in fact in LASD's care. So if LASD wants to have accurate accounting of those who die in its custody, Stanley's death should not be erased. It should be added to its online in-custody death tracker. There was nothing natural about Stanley's death. It was the result of his encounter with LASD. How many more families must lose a loved one in the custody of LASD before systemic changes occur to patterns and practices within LASD, especially when judges deem incarcerated individuals incompetent to stand trial and order their transfer to county jails from county jails to mental health hospitals. So in closing, the Stiavetti ruling reinforces that jails cannot substitute for clinical hospitals and that prolonged delays violate constitutional rights. And Stanley's case and death exemplifies how failures in interagency coordination, institutional inertia, flawed and delayed transfer implementation can result in death rather than restoration. In comparing jails to mental health hospitals, these transfer pathways expose systemic vulnerabilities at the intersection of legal rights, medical care, and correctional governance. Thank you very much.
Thank you, Dr. Lucas. Our last speaker is Ms. Helen Jones from Dignity and Power Now. Ms. Helen Jones was born and raised in Watts, California, and is the mother of John Horton, civil rights activist, and is the founder of Head High Entertainment. In 1998, Helen started a music label to help young people develop their voices, music, and writing skills, and to help them turn their lives around. On March 30th, 2009, Helen's son, John, died while in LASD custody at the Men's Central Jail. Originally, his death was ruled a suicide, which was later changed to undetermined. Helen has been fighting for justice, accountability for all, and she is a senior campaign lead with Dignity and Power Now and with the Justice LA, and is also co-chair of Check the Sheriffs. She's a thought leader with UCLA Lab to help stop the modern genocide of in-custody deaths and to close Men's Central Jail down with no replacement jail, and to hold sheriffs and law enforcement accountable for their abuse, killings, and crimes, and to shut Men's Central Jail down now to save lives. Ms. Jones, again, thank you for being here tonight, and please go ahead.
Thank you. My name is Helen Jones. I'm a senior campaign lead with Dignity and Power Now. Thank you for having me, and thank you for welcoming our org, Dignity and Power Now. I would like to start first with the reality of incarceration. Is the slides up? No?
You didn't receive any slides, but you can continue.
Well, thank you. Well, I'll start here with the reality of incarceration in Los Angeles County. No? Thank you so much for your patience.
For those remote, we are attempting to load slides provided by Ms. Jones for the proceeding. And we thank our staff for rolling with this minor wrinkle, and we thank all the panelists for their patience as we try to get this loaded to improve the quality of information presented and to ensure the full intended presentation by Ms. Jones.
Thank you so much.
Okay. We're going to take this opportunity to take a brief recess for refreshments or for getting up and stretching. We will be right back in about 2 or 3 minutes max with Ms. Jones' presentation ready to go. Thank you.
Thank you.
have we have projection capability here. So let's resume the presentation by Ms. Helen Jones, and we will do our best to project the content on PDF on the screen. Ms. Jones, welcome back. The floor is yours. Please continue.
Thank you. For the sake of time, I'm gonna go as fast as I can to get through this presentation. Thank you so much. The reality of incarceration in Los Angeles County is the number of in-custody deaths since 2009, complaint numbers compared to investigations, abuse, neglect, and care, like beating folks with flashlight therapy, handcuffing inmates while they beat them, and the carelessness that they gave Joseph Perez. After his beating, they didn't give Joseph Perez no care at all. And his mother is traumatized to this day for the care that they did not give her son. Next slide. Next slide, please. Men's Central Jail makes custody violent again. This photograph belongs to the bailiff in Judge Bork's courtroom in Los Angeles, 2026. Next slide, please. One death every 8 days from 2020 present day. There have been 274 in custody deaths in Los Angeles County. Next slide, please. This is data showed that how many deaths started in 2013. You see the deaths started with 34 deaths. It declined down to a slope in 2015 to 21 deaths, rose up again, 26 deaths in 2017, 30 in 2018, all the way up to 2021 with 55 deaths. It climbed down a little bit to 20 in 2022, 42 deaths. In 2023, 45 deaths, but back up in 2025 with 46 deaths. Next slide, please. My son, John Horton, was murdered by sheriff deputies on March 30th, 2009. John's death was originally labeled a suicide and was later changed to undetermined by LA County Chief Medical Examiner. Next slide, please. Murdered by the 3,000 boys on March 30th, 2009. The 3,000 boys operated in Men's Central Jail and emerged in the 2000s. Deputies operating at correctional facilities often physically abuse or torture those in custody with objectives such as causing the hospitalization of victims or the fracture of bones seen as desirable or necessary for initiation. The 3,000 boys may be the largest deputy gang within LSD. Members are tattooed with a 3 on their calf, earned by using excessive force against an inmate and then filing a false report thereafter. Next slide. LSD deputy gangs 3,000 boys throw up they 3 fingers and a B with a thumb and index finger. And they also have tattoos on their calves, and they also have tattoos of the barcode of the 3,000 floor and the number 3,000 on the back of their heads. They shaved heads. Next slide, please. This photo is a photo of my son, John Horton. We didn't want to show his whole body because of, community viewing and just to be respectful to everyone. This is John pants, and this is the blood splatter that was on John pants. Is coagulated, is also double stacked with double blood spots that drip on top of each other. And these are 3 photos that we wanted to show, just to show that this was not a suicide from day one. Next slide, please. This is also another photo of John, just showing you how dark the blood splatter is on his pants, how thick it was. And it looked like John was shot with a shotgun. That's how much blood splatter that he had on his pants. Next slide, please. This is a closer up photo of John, blood splatter on his pants. That was never noted in public about the blood splatter on John's clothes, but we just want you to see that the blood splatter and how thick the blood splatter was on John's clothes. Next slide, please. These are also photos of John, which we also blurred a little bit because we didn't really want to show his face too much to, just for respect. On John's forehead is where he'd been hit with the flashlight. It left a knot and a blood clot on his forehead and the lines from the flashlight print on his forehead. Also on the other side is is the same spot. We just want to show you in deeper color how you could just see the blood clot, how hard he was hitting his head, and his nose was broken also. Next slide, please. This is another photo of John when hitting his head and his nose was broke. Also a knot on his head, and he was also hit on the side of his head and his temple. And we just want to show you the after effect of flashlight therapy. This is what flashlight therapy looks like after inmate or loved one has been beaten. Next slide, please. These are 5 other loved ones that have died, been murdered or killed or neglected in the jail. And the family still don't really know what happened to their loved ones today because the secrecy around us getting accountability and justice for our loved ones and knowing what really happened to them, and their reports are altered and falsified by LSAD and the county coroner. Next slide, please. I just want to say the abuse continues. Killed on September the 22nd, 2021, while in solitary confinement at Men's Central Jail. On the 3,000 floor, death was ruled and overdose while bodies showed major signs of abuse. And that was Jelani Lovett. Quentin Thomas killed on March 9, 2018, while incarcerated at Twin Towers. Deputies and staff neglected Quentin's medical issues. Quentin died just 7 days after being incarcerated. Joseph Perez attacked and beaten by sheriff deputies. He continued to not receive adequate medical treatment while incarcerated to his day. And his mother, Vanessa Perez, is suffering and really would want help and just trying to show the injustice to what they're doing to the folks that's inside, our community members and our loved ones. Also, Maxwell Aguri, Air Force veteran, died September the 23rd. While at the Twin Towers, deputies failed to perform mandatory Title 15 security checks. Instead of performing these security checks, deputies were watching YouTube videos. Next slide, please. Demands: reopen John case, separate county coroner and sheriff department. 3, unqualified immunity. 4, civilian third party that handles internal affairs. 5, mandatory personal liability insurance officers will be required to carry insurance where they pay the difference in premiums if their claim history increases rates, potentially barring them repeat offenders from employment if they cannot secure coverage. Settlements must come from responsible deputies' 401k or insurance. 6, use AB 847 to investigate gangs deputies. And let me just do a couple of more, and I'll end this. Deputy gangs, the Center for Juvenile Law Policies at LMU, Loyola Law School. Also, you can read Cerise Castle's her series on Deputy Gang, 815-part investigative series by Cerise Castle. Also, I want to say this fast as I can: 20 known LSD gangs. The Bandidos, Buffalo Soldiers, Cavemen, Cowboys, Executioner, Green Reapers, Industry Indians, Jump Out Boys, Little Red Devils, and the Pirates. Posse, Rattlesnake, Regulators, Spartans, Tasmania Devils, 3,000 Boys, 2,000 Boys, V-Boys, Vikings, and Wayside Whiteys. Also, Linwood Vikings and Fort Apache. And I just want to say thank you for listening. I know we're running out of time, but I just want to say thank you for having me on the panel. Thank you.
Thank you, Ms. Jones.
With that, I want to be able to turn to questions from the audience, and I want to thank those who've waited patiently. We're going to try to go a little bit longer than our allotted time, given the quality of the presentations. And in particular, I want to thank the 2 surviving parents who bore witness here with us today for your experiences and for your insights, which added incredible value to this gathering, and I think also shows the perseverance and the courage needed to confront the facts and some entrenched authority that is inherent in this advocacy. So thank you in particular for your contributions this evening. The quality of the questions submitted on index cards is really overwhelming to this chair and much appreciated because of the clarity and the breadth of questions. And I think the range of research that people have done in advance of coming here tonight. So I want to thank those who shared their questions. Even if we're not able to get to your question, I want to thank you for bringing them in, because of the extraordinary quality and the clarity and the focus of some of these questions. I want to first turn to a question directed to the medical examiner and to Dr. Ukpo. Are there any autopsies or investigative files that are currently on security hold? We have a sheriff who ran on the Pledge of Transparency, and we're hoping that the medical examiner can do some steps to fulfill that pledge despite the independence of your agency. Are there any autopsies or investigative files that are on security hold?
Thank you for that question. I first want to establish that we are not the coroner's office. Coroner's office is composed of an individual that's elected that has the position to determine the cause of, the manner of death. And these individuals hire physicians to determine the cause of death, and then they separately determine the manner of death. In this circumstance, the individual frequently works out of the law enforcement agency. We are a medical examiner's office, separate and independent of the sheriff's department or any other law enforcement agency. When I took on my role 3 years ago, we had approximately 52 cases that were on security hold. It was one of my first things to do was to ensure that people know the causes of death that are happening in the community, to be part of that change that needs to be affected. In order to do that, I had to release the security holds on these cases. And we don't have any other than those that have been mandated by court order. And in the spirit of transparency, there is no in custody death that we have that is under security hold today. I hope that answers the question.
Thank you.
Another component.
Yeah, thank you for your candor, and also thank you for clarifying the roles of distinct agencies. This is a question for Captain Boteo. Who is tasked with assessing inmate health and reporting deteriorating or decompensating conditions by incarcerated people? What are the barriers to obtaining health checks? A question for Captain Boteo.
So ultimately, it's a dual, excuse me. Okay, so ultimately, it's a dual role. If you're talking about those that are incarcerated that are exhibiting signs or symptoms of being in some form of medical distress, then it's the deputy's responsibility if they're the ones that actually discover that or see that and detect that and summon medical assistance. And then it becomes correctional health services to then provide that care.
And
Feel free to chime in. Yeah.
I was going to say, just to follow up on what Captain Botello was explaining, and to make a clarification, Correctional Health Services is a division of the Department of Health Services. We are not under the sheriff, and we don't report up to Sheriff Luna or anyone in the custodial chain. We are a division under Department of Health Services, funded by a different funding stream through the county. So our budget is not connected to the sheriff as well. But to reinforce what Captain Botello was sharing, that identification of health needs is joint between custody, who is often is on the units more than healthcare staff, but healthcare staff are also rounding. Healthcare staff may be doing pill calls, maybe doing sick call triage, And those are opportunities also for healthcare staff to make reports of healthcare needs. There's also a system for incarcerated individuals to report that they have a healthcare need. We call those is it not close enough? Sorry. Thank you. We call those health service requests. So any individual can put in a request for their own needs as well. Family members who are made aware of concerns can call and can put forth a concern that can be looked into.
Well, staying on that point from the questioner, I have received reports of people incarcerated who are being forced to choose between medical or sick treatment on a call or going to court or getting visits. What is being done about this practice, and can it be justified?
Sure, it brings up a very difficult problem that we experience. Sometimes we have 13,000 incarcerated individuals, and sometimes we are scheduling out weeks in advance for medical appointments, and especially for specialty appointments, they may be months in advance because the individual leaves the site to go to that medical appointment. We aren't aware necessarily of a court date or an upcoming visit, and so we aren't able to align those things, especially that far in advance. We are working we are working to develop a system where if someone misses because of court, if they miss their medical appointment, that we can move them to the top of the list again to get seen as speedily as possible. But it's very difficult because, again, like I said, individuals are scheduled days, weeks, sometimes months in advance for certain procedures.
I guess a secondary aspect of that question is for Captain Bateo. If incarcerated people are being communicated about those as a trade-off, or if there is a communication made to people that their treatment is being withheld or that it's being denied on a punitive basis, can you clarify whether that's the case or what might be done to redress that?
I think to set really kind of an operational background, if I can.
Yeah.
Is it closer?
Thank
It's
you.
got to be right here.
Thank you.
Okay. So from an operational background, just to give it context so that I think that the public and the community can really understand how things work on a day-to-day. There is never a malicious intent to or a punitive intent to deny someone care. And oftentimes, if people know, and if I can be a part of that explanation, I'll be glad to do so, to shed light operationally on how it works. And simply put, when an individual has a court date, those passes come at 0300 hours in the morning. And at that point in time, there is no indication or knowledge that there's a medical pass that's been issued for that individual to receive treatment or care. So by that time that potential pass or appointment has come up, that individual may have already gone to court. And ultimately, we have to fill that gap and prioritize that individual for treatment upon his return or her return. But no, there's no trade-off in the sense of that. Usually they're gone by the time that the realization is made. So that's how that works.
Thank you.
In the background. Mm-hmm.
Next question is for Chair Haley Broder of the Civil Brand Commission. What prevents the county from commissioning an independent root cause analysis about in-custody deaths to better understand environmental and institutional factors contributing to the crisis of in-custody deaths?
I wish I knew. I wish we could make that happen, and that is definitely a recommendation that the Civil Brand Commission has put forward. It's part of our annual report and our findings. The board recently passed a motion about environmental conditions in the jails, and that is something that we are continuing to inspect and report on. That is particularly looking at conditions like water, mold, air quality, other public health issues, and reporting forward on what the county needs to do to change those.
Thank you. The next question may go to Dr. Ukpo. Wanted to ask, I think the questioner identifies himself as Nick Shapiro, a researcher with UCLA, finding that people in LA jails are 49% more likely to die of overdoses than those unincarcerated in California. And jailed people in LA are 882% more likely to die of gastrointestinal bleeds. Wanted to ask what can be done to address those causes or to create some accountability for those risk factors on incarcerated people in Los Angeles County. We may follow up on another person besides putting this to you.
Yeah, thank you for that question. The role of medical examiner is to alert individuals to causes of sudden unexpected deaths in order to prevent future deaths. So we inform those preventions by informing individuals of how this person died. So if, for example, the medical examiner's expertise to be able to determine that the death was in fact due to drugs informs the targeted prevention. The medical examiner's office is not a regulatory agency or one that makes recommendations of any sort of prevention as to specifically any particular situation. We leave that to the people who are involved with the care of that individual to then use that information to then provide these targeted preventions. And so the question to answer, what can we do? What should we do? It's out of the scope of what the medical examiner does, which is an informing body that is involved with 12,000 deaths in the county. Of that, the jail population is one. But we want to make sure that whatever we share can be taken to use that information to determine, well, if the person died of this cause, how can we prevent it? And that's our role. I can't speak to the figures provided. I can't verify them. However, there are multiple causes of death that do happen in the county, drugs being one of the most common.
Shifting back to correctional health services, to Doctors Belovich and Henderson, has CHS ever recorded or documented interference by LASD with medical care or medical recommendations made by correctional health services?
I'm sorry, I think you said, have we ever documented or been aware of interference? I don't think, I'm not aware of interference. I think a challenge that we've experienced partnering with custody is at times the access to care, and access to care has to do with the staffing that is available to provide the patients to our staff. And so that's always been a challenge. I think going back several years because of staffing challenges on the LASD side, staffing challenges on the correctional health side as well. Significant challenges in correctional health care until about 2 years ago when we were able to significantly increase staffing through funding through the CEO's office. But I'm not aware of interference in providing healthcare, but I do think there are challenges that we have providing healthcare. I think it echoes a lot of what's been said here today. These jails were not built to be hospitals, to provide healthcare, to provide mental health care. These are places that were built to incarcerate individuals, and they have by default become places where we are forced to provide that care because that care doesn't exist in the community.
Sure, Captain Pateo.
And I would actually add on to that, as the captain of Access to Care Bureau, which is a secondary bureau that I oversee, I would 100% agree that there's always challenges in providing access to care that does not just deal with lack of resource allocation by staffing. We're talking about classification of inmates that require, or incarcerated individuals that require specialty escorts due to the nature of their security classification that create special challenges for the department and Access to Care Bureau. So we're always looking for ways to meet those challenges, to overcome those barriers and provide the care. And working jointly with CHS, I think, is fundamental to that endeavor.
Chair Broder.
Thank you. I'd like to just add that the Civil Brand Commission on Inspections has observed and talked to multiple individuals who have reported retaliation and lack of access to medical care, including medical devices and provision of services from CHS that they are not allowed to access as a retaliatory measure.
Maybe staying on that theme just briefly, I think this is a question intended for Captain Boteo. Does the Sheriff's Department ban the use of cell phones and other distracting devices in order to maintain a hyper-vigilant environment over inmates?
So cell phones are illegal to bring into the secured area of any custody facility. It's a misdemeanor. So they're not, staff is, in terms of custody staff, are not allowed to have those at all.
What happens if there is a report or an observation of staff using a cell phone?
So dependent upon the person who's observing that behavior, I would expect that that individual report it to a supervisor so that supervisor can take appropriate action, both administratively and criminally, because it's a misdemeanor.
And would that go to the watch commander?
Again, depending on the entity, the person that's observing the conduct, but ideally, yes, you would want to begin there, and that can trigger all of the ensuing events to ensure that it's adequately addressed.
And would any of those make their way to you in any way?
In my former role as internal affairs, maybe, but no, I mean, in terms if that's my individual under my supervision, of course, yes, but in the normal course, it would go through the respective units.
Thank you. A question for Ms. Ganter. If Ms. Ganter is still with us, what is the relationship between the medical examiner and correctional health services? And what is the channel for the medical examiner or CHS to raise complaints about misconduct or negligence regarding a death to BSCC for the review that you discussed, even with the limitations of your investigatory authority or follow-up for any related discipline?
That was a kind of a long question. I'm going to try to answer it by saying we have no formal, again, no formal communication with correctional healthcare services in Los Angeles County. If there were a concern, they could contact us. We haven't begun our medical and mental health reviews in the local detention facilities. When we do, we will obviously be reviewing records, healthcare records for people who have died in custody, and we'll have interaction obviously with, in Los Angeles, staff of that entity. But as of right now, there's no formal communication between us. I hope that answers the question.
Yes, Dr. Belovich.
Yeah, I agree. As Ms. Ganter said, there's no direct line there. But if correctional health staff have any concern, they can bring it up to their supervisors or to, all the way up to my office. But more than likely, we would see, or we would encourage them also to reach out to our partners at the OIG, who is independent from us. So if they don't feel comfortable within the confines of the jail, the OIG maintains that separateness where our staff can and have been able to discuss concerns.
On that score, I just want to follow up with Dr. Henderson. What is being done to make sure that doctors and nurses in correctional health services are not experiencing fatigue or desensitization because of the conditions that we're shining a light on here, the crisis of in-custody deaths?
It's a good question, and I would say honestly, there's no specific programs. I mean, we attempt to do things that are not directly patient care with our equity and diversity activities and our opportunities to meet as a group. There is and I've forgotten the name now. Yeah, there's a wellness group that actually meets and but there's actually another program that I'm trying to think of right now, and I'm having a moment, but there's nothing specific tailored for correctional health and the possible PTSD that could develop dealing with the same population, the same conditions on an ongoing basis. It's probably a place we can do it, we can improve.
Thank you for that. And I wanted to ask Captain Botello, what prevents corrective action plans created in response to in-custody deaths from being disclosed to the public, if anything?
Well, you know, the information is considered attorney work product privilege. So it doesn't mean to say that there's modes of inquiry that are outside. And I have to really kind of address this, that sometimes I think that in that respect, the information those death books now are going over to the BSCC in a comprehensive, unfettered manner. And we anticipate and look forward to their recommendations upon the review of those death books and those in-custody deaths. I invite it. The task items that we look at, as I speak here tonight, plainly tell you that there's various modalities that we look at, areas of concern that we look at every time that are not necessarily deficiencies that I would call them, but those also end up in what we consider our corrective action without necessarily being one to address these overarching systemic concerns.
Is there anything that you can summarize or crystallize tonight about any pattern of corrective action plans that you think might be worth sharing or of great interest to panelists or people here tonight? Is there anything or a pattern that you've observed of corrective action plans that can be uplifted tonight?
Well, I think in terms of again, these modalities, right? I think I can speak in broad terms, probably about 5, where they're not, I would not, again, consider them deficiency. They're areas of concern that we typically look at. And those are often going to deal with were our inmate safety checks timely? Were they of quality? What was the level of health care that was offered? And can we look in areas to improve that? What was the nature of our emergency medical response at the time of discovery and thereafter? There's a whole gamut that we look at. We look at the potential for contraband or illicit drugs to be present and available to that individual, and what has that unit done to control for that. So those are just a number of task items that we look at every time. And I think that we have learned to expect that in the last 3 or 4 or 5 years, that's how we're going to engage in our review, that it's going to be a scrutiny from top to bottom. And again, I would stress that when we identify deficiencies, we are quick to immediately assign that task item, and there is follow-up and adequate proof of practice that at our unit, DRT, Death Review Team, that we're the stalwart bulwarks, the sort of stopgap measure to ensure that those practices are followed through appropriately. So, sorry if that.
No, the same question might also come to you. Are there any steps that you have taken to prevent desensitization or to prevent overload from the statistics and the cases that you are reviewing? Even while not in a clinical setting, you might still face some of the same stressors and pressures towards desensitization that might affect clinicians and caregivers?
So I think if we're talking about me personally, is that your question, me personally?
Or any people in your command?
I think that, so, the Sheriff's Department, generally speaking, and Sheriff Luna specifically, emphasizes employee wellness. And we have wellness rooms, we have discussions, and the way that we look at wellness is has really kind of expanded in the last few years. So for sorry, my braces, for, ensuring that we remain sensitive. I think a lot of it is my observation of my staff to ensure that they're doing their job, but they're doing so sensitively, with the understanding that that was still a person, that's still a human being that died without the presence of their loved ones. And it's what I expect of them. And I see nothing less than the utmost professionalism. And they're very good at what they do. So yes, I oversee and I monitor that to ensure that that happens. And I can say of my team that I'm proud of the small team that I have that works very diligently to put these death reviews together.
What is your DRT team? How many members on it?
5 plus 1 lieutenant who's here with me tonight.
Excellent, thank you. I want to shift to online questions. Mr. Flores, do we have 2 or 3 questions online that we might take in our remaining allotted time?
Chair Johnson, we have one question online. So the first question is, if a person was moved from the jail to the hospital and dies in the hospital, is this considered to be an in-custody death? And this is part of the same question. Could we determine whether jail actions or conditions contributed to the cause of death?
If a person leaves the basin or one of the other facilities and goes to hospital, regardless of how long they stay at hospital, they are reviewed by us in the same fashion as if they had died in the jail. So we look at everything that may have led up to the hospitalization, anything we may have missed, any gaps in care. And so, yes, those still count. And in fact, we will if you're released from custody and have an imminent death, we will also review those with the same scrutiny.
Is there any follow-up?
No, he's exactly right. We treat those as an in-custody death. That person is still, of course, is incarcerated, and we treat it as such, and we provide the reviews, and just as he mentioned, the same exhaustive review.
Thank you. With that, I wanted to ask, does Dr. Lucas perhaps have a final question from the panel to a fellow panelist?
I would like to ask the sheriff, it's sheriff, right? I'm sorry.
The Civilian Oversight Commission?
Oh,
Captain
the
Mateo.
captain, I'm sorry, the captain. You just mentioned that if someone dies in the hospital, they're still in the custody of LASD, correct? Is that what you just said?
Yes, if they're still within our custody, yes.
Mhm. And I guess I'm, just thinking about Stanley's death, and I have 2 questions for you. Stanley was in the sheriff's custody being transferred, and he was not considered in your custody, but he was at Metropolitan State Hospital. And so I'm just wondering what led his death to not be counted? Because the deputies were there. And so I'm just a little concerned about, I don't know if deputies on site determine the definition of what a death in custody is. Maybe there's some misunderstanding there, but he was not counted. The other thing that did was, and this is my second question, is that he is not in your in custody death online database, but a judge has ruled that he was actually in your custody. So here's my question. I'm sure when the California State Legislature enacted AB 2761, requiring all deaths to be listed. They did not anticipate this type of undercounting because essentially the numbers that you have publicly, I know, is an undercount by one. And we know that Stanley is uncounted, but we know who he is. I believe there are a lot of individuals out there who are uncounted, but we don't know who they are. When a judge rules that someone actually was in your custody, can LASD now say that individual needs to be included for a more accurate count because Stanley still is not listed?
So I'll address this in a couple of different ways. One, if this is pending civil litigation, I will tell you that we're not at liberty to speak on circumstances or specifics regarding the tragic event of your son's passing. But I will tell you that we adhere to the penal code. It's 10,008, right, which defines what an in-custody death is. And I will say that we also follow the guidelines with respect to what is considered a post-release death. And we work and follow and are aligned with the penal code and the California Department of Justice in terms of our in-custody death reporting. And I'm here to tell you if the department is receiving an order to list that death, then we shall do so. But,
Okay. All right. Thank you very much. Thank you.
I want to thank all of the panelists for being here tonight. I want to thank all of the participants in person and remotely joining us. I want to thank all in particular who are here as family members bearing witness to your loss and to the struggle for facts and reckoning that entails. And I want to invite all participants to our Civilian Oversight Commission meeting a week from today on the 16th from 9 a.m. to 1 p.m. at St. Anne's in South Silver Lake here in Los Angeles to continue the work of civilian oversight here in Los Angeles County, in which all of us can be partners and which we can all overcome adversarial relationships of the past with some honest teamwork and joint cohesive work together. Thank you all again. And I'll give it to
I just wanted to add, in that meeting, in our next meeting, on the agenda there'll be a presentation regarding LASD's implementation of the board's March 3rd, 2026 motion. In addition, the commission will consider a new business item to assign follow-up responsibilities related to that motion to the Jail Conditions and Staffing Ad Hoc Committee for coordination and monitoring. Given the importance of this topic, as we heard today, and the need for continued dialogue, the commission is planning to host a second session of this forum to further explore these issues. So thank you all for your participation.
Buenas noches and good night.